Good day. My name is Michael Rooks. I'm coming to you from Port Orange, Florida. The topic of today's presentation is functional anatomy of the hand. The human hand is a miraculous structure. It is our primary method of manipulation with the external world. Understanding the hand's unique anatomical structure and how it relates to function is a prerequisite to recognizing and treating illnesses, injuries, and anomalies of the hand. Today's installment on the functional anatomy of the hand is the thinner elements of the hand, or more concisely, the thumb. Although baboons and gorillas exhibit a thumb opposition pattern similar to man, the degree and functionality present in humans is unique to the animal kingdom. Opposition allows fine object manipulation and dexterity not seen in other animals. This ability alone defines the human hand. Thumb opposition is a combination of pronation, axial rotation, flexion, and adduction. Normally, this encompasses an arc of approximately 110 degrees. Thumb opposition is assisted by a similar, albeit more limited, rotation of the fifth digit ray. The unique design of the thumb facilitates this function. Several differences from the other digits immediately become apparent when examining the thumb. Most obvious is the loss of an bony element, with three instead of the normal four bones in the ray. This is accompanied by a significant increase in metacarpal carpal motion compared to the other digits. This increased metacarpal carpal motion of the thumb converts these three bones into an intercalated segment similar to what is seen in the other digits with a more stable metacarpal carpal joint, possibly explaining the loss of a bone in the thumb. The mobility of the metacarpal trapezial joint is integral to the function of opposition. The bones of the thumb are the metacarpal, proximal, and distal phalanges. The interphalangeal joint is uniaxial. The metacarpal phalangeal joint is primarily uniaxial, with limited abduction and adduction. Motion in these two joints is significantly less than that seen in the minor digits. The metacarpal trapezial joint, on the other hand, is a triaxial, very mobile joint. This joint is the major source of motion or opposition, with lesser assistance from the interphalangeal flexion and abduction at the other two joints. The thumb sits in approximately 80 degrees of pronation relative to the other digits. Another 15 to 20 degrees of pronation is obtained with metacarpal flexion. The metacarpal trapezial joint is a complex saddle joint. The metacarpal surface is concave sagittally and convex in the coronal plane. The articulating surface of the trapezium is reversed. The radial aspect of the trapezial articulation is larger than the ulnar. This alignment, aided by ligament actions, produces metacarpal pronation with flexion. Abduction and adduction have no effect on this rotation. The metacarpal trapezial joint is stabilized by several named ligaments. The major ligaments include the anterior oblique or beak ligament, consisting of a deep and superficial component. This ligament is thought to assist in pronation. The joint is stabilized posteriorly by the posterior oblique, dorsal central, and dorsal radial ligaments. Several other minor ligaments are present, including the ulnar collateral and anterior volar ligaments. There is a plethora of other ligaments connecting the thumb, metacarpal, and trapezium to adjacent bones. The primary stabilizers of the thumb are the anterior oblique and dorsal radial ligaments. The metacarpal trapezial joint is dynamically stabilized by attachments of the first dorsal interosseous and opponent muscles to the joint capsule. Metacarpal trapezial fracture dislocations, Bennett fractures, result from intra-articular fracture of the volar lip. This usually results from metacarpal flexion and compression. The anterior capsule, including the anterior oblique ligaments, usually remain attached to this volar lip fragment. The rest of the metacarpal is unstable under the pull of the abductor pollicis longus. Open reduction and internal fixation is required for stability. Gradual metacarpal trapezial instability over time is thought to be a determinant in osteoarthritis of this joint. This is thought to occur primarily from laxity and the dorsal radial ligaments. The metacarpal phalangeal joint of the thumb is unique in its ubiquitous possession of two sesamoids. These are embedded in the volar plate, articulating with the metacarpal head. They serve to stabilize and protect the thumb long flexor at this joint. This anatomy is a constant finding in all of the MP joints of digigrade carnivores. The ligamentous anatomy is similar to the other MP joints. However, with more proximal positioning of the dorsal aponeurosis, ulnar collateral ligament tears can be trapped dorsal to this aponeurosis. This is known as a Stenner's lesion. Uncorrected, this can lead to chronic MP joint instability. Surgical repair is indicated when a Stenner's lesion is expected. The thumb has 4 extrinsic and 6 intrinsic muscles. The flexor pollicis longus is primarily an IP joint flexor. The extensor pollicis longus is an IP extensor and metacarpal adductor inserting on the dorsal distal phalanx. The extensor pollicis brevis extends the MP joint and abducts the metacarpal, with insertions into the dorsal proximal phalangeal base. The abductor pollicis longus has insertions into the metacarpal base, trapezium, and the abductor pollicis brevis. Intrinsics include the opponens pollicis, abductor pollicis brevis, deep and superficial flexor pollicis brevis, adductor pollicis, and the first dorsal interosseous. The first dorsal interosseous stabilizes the metacarpal base against the abductor pollicis longus with origins on the joint capsule. The adductor pollicis has oblique and transverse muscles. The oblique head originates from the second, third metacarpal base. The transverse head originates from the third metacarpal shaft. Both muscles insert into the ulnar tendon at the MP joint with extensions into the dorsal aponeurosis. The remaining intrinsics take origin from the transverse carpal ligament and trapezium. The opponens pollicis inserts on the metacarpal, where it abducts and flexes the metacarpus. The abductor pollicis brevis inserts on the proximal phalanx directly and works in concert with the opponens. The flexor pollicis brevis inserts into the radial tendon at the MP joint, again with extensions into the dorsal hood. The adductor pollicis and flexor pollicis extensions into the dorsal aponeurosis assist in IP joint extension. Collapsed deformities of the thumb are designated boutonniere or swan neck, as with the other digits. However, etiologies vary somewhat. A boutonniere thumb results from loss or insufficiency of the extensor pollicis brevis. This can be congenital, traumatic, infectious, or inflammatory. Thumb swan neck deformities can result from many of the same problems as with the other digits. These include MP volar plate laxity, loss of the distal extensor pollicis longus insertion, or contractures and spasticity in the intrinsics. However, most swan neck deformities of the thumb occur from pathology in the metacarpal trapezial joint. Loss of abduction and extension in this joint leads to compensatory hyperextension and instability in the MP joint. The fifth digit has 3 extrinsic muscles, excluding the extensor carpi ulnaris, and 5 intrinsics. The volar interosseous and lumbrical have been previously discussed. The remaining 3 intrinsics are referred to as the hypothenars. The abductor digiti minimus, flexor digiti minimus, and opponens minimus have origins and insertions analogous to the thenar counterparts. The abductor originates from the pisiform and the other 2 from the hamate hoof. The abductor sees a role analogous to the dorsal interossei with small finger abduction, MP flexion, and IP extension. The opponens flexes and abducts the metacarpal. The flexor flexes the metacarpal, MP joint, and aids in extension to the IP joints. The increased flexion of the ulnar 2 metacarpals and slight rotation in the 5th metacarpal complement the opposition of the thumb and aid in both opposition and grip. If you have made it to this point, congratulations are in order. Thank you for your time and your attention. I hope you have found something of use in this presentation.